Welcome to the new patient education series on gout. My name is Dr. Sanjeev Bagga, and I'm going to be talking about gout. I got some of this information from the Merck manual, and these slides are only for patient education. Gout is essentially caused by high urate levels in the bloodstream or high uric acid, and this is because of precipitation of the monosodium urate crystals in and around the joints. Typically, one joint is involved, and it leads to recurrent acute or chronic arthritis. The joint that is most commonly involved is the greater toe, the first metatarsophalangeal joint. Patients present symptoms of acute severe pain, and there's a lot of pain and tenderness with warmth, redness, and swelling of the greater toe first MTP joint or metatarsophalangeal joint. The diagnosis requires the identification of crystals in the synovial fluid. Synovial fluid is the fluid in the joint space, and the treatment is with anti-inflammatory drugs that I will be talking about shortly. The frequency of these attacks can be reduced by regular use of non-steroidal anti-inflammatory drugs such as ibuprofen, colchicine, or both. Now, once you lower the urate level with allopurinol, febuxostat, or uricosuric drugs such as lesinurad and probenecid. Now, uricosuric drugs basically mean that they cause more excretion of uric acid in the urine. Now, gout is more common amongst men than women. It is typically seen in middle-aged men and after menopause in women. It is rarely seen in younger people, and it often runs in families. Now, the uric acid levels can be increased because of three reasons. One is that the body is not excreting it adequately. So this is the most common cause, or it could be because there is an increased production of uric acid in the blood or body, and then there is increased purine intake, which is the basic material which leads to uric acid formation. So these are the three causes, but the most common is that the body is not excreting uric acid adequately. Why some people develop gout or increase uric acid is not very clear, but as I mentioned, the decreased renal excretion or excretion through the urine is the most common cause of increase in the uric acid. Now, this can be hereditary. It can be because of patients who are on diuretics. Diuretics are medicines which produce more urine, and some of them have this side effect. And those diseases which cause decrease in the glomerular filtration rate or the filtration function of the kidneys. Now, alcohol can increase purine catabolism. Purine is the substance which leads to uric acid formation. So if you drink alcohol, it increases the purine. Catabolism is the breakdown of purine in the liver, which leads to more lactic acid formation, which blocks urate secretion by the kidneys, and this leads to more urate synthesis. Additionally, the increased production of uric acid or urate may be because of increased turnover of nucleoproteins in some blood conditions such as lymphoma, leukemia, and a condition called hemolytic anemia, where there is a breakdown of the red blood cells, and in conditions where there is increased production of cells and cell death, such as psoriasis, those who are on cancer chemotherapy and radiation therapy. Additionally, as I mentioned, this could be a hereditary problem, or this is also seen in obese people. Now, there are some foods which are rich in purine, such as liver, kidney, anchovies, asparagus, consomme, herring, meat gravies and broths, mushrooms, mussels, sardines, sweetbreads. These all can contribute to increase in the uric acid. Now, beer is particularly rich in guanosine, which is a purine nucleoside. So it's the basic substance which produces uric acid or urate in the bloodstream. But unfortunately, a strict low purine diet will lower your serum urate only by about 1 milligram per deciliter. So you need to take medication. And as I mentioned, that the most common cause of gout is decreased uric acid excretion by the kidneys, which may be related to diuretics, which are the medications some patients use for increasing their urine production, maybe because of kidney disorders, or it may be because of a hereditary reason. Now, if you have a patient who has a sudden unexplained pain in one joint, or it can be more than one joint, but typically one joint, particularly if it is the great toe of the foot, sudden pain, unexplained acute arthritis which remits on its own, or if you confirm this diagnosis by finding needle shaped crystals in the joint fluid, the diagnosis of gout can be made in this fashion. And the treatment consists of giving the patient oral colchicine, non steroidal anti inflammatory drugs, also steroids or a combination of colchicine with non steroidal anti inflammatory drugs such as ibuprofen and a steroid. And you can decrease the future risk of attacks by prescribing colchicine, a non-steroidal anti-inflammatory drugs, and when indicated, drugs to decrease the serum urate levels. Now, remember that you give drugs that decrease serum urate if the patients have tophi. Tophi are these deposits of uric acid in around the joint, and if the patient has more than 2 flares of gout per year, or if the patient is having stones, uric acid stones in the kidneys, ureters, or urinary bladder, and you can decrease the urate levels by prescribing allopurinol or this medication called fiboxystat alone or a combination.